I'd like to introduce our next two guests on panel 2. The first is Devon Pack. Devon was appointed as the District 2 representative for the San Benito Healthcare District by the San Benito Board of Supervisors in December 2022 and previously served as a San Benito County Planning Commissioner. Welcome, Devon.
Good evening.
Our second panelist is Binu Abraham. Got that right? Binu is the Executive Director of the Council of Governments. She is new to San Benito County. She has been here for 10 months, so we're giving her a warm welcome. Binu previously served as the Principal Analyst for the Sacramento Area Council of Governments. She has a college-age daughter in Chicago, and she and her husband live here in Hollister, and she loves San Benito County. Welcome, Binu.
Thank you.
Okay, so we're going to jump right in. Am I doing? You're doing? I'm doing the questions. Okay. Yes. Yes. Devon, we're going to start with you. Okay, and the format will be similar to the first panel, which is I will ask you 2 questions, and then Larry will ask Binu 2 questions, and then we will open it up to the audience for your questions. Okay. So, our first question, Devon, is many public hospitals are experiencing financial problems. What are the root causes of Hazel Hawkins' financial difficulties?
Well, I would describe Hazel Hawkins' difficulties as being a couple of factors. One factor is that the rate of Medicare and Medi-Cal compensation has not been increasing at the same rate as we have seen the inflation in the costs of labor, the costs of medication, and in the costs of medical equipment from our vendors. That is one factor. Another factor that we are facing is that basically business and patients and services are going to procedures in Santa Clara and in Monterey County, and we're not getting a reciprocal, a reciprocation of patients coming to Hazel Hawkins. So in many cases, we handle the initial diagnostic, the initial emergency room services, but the larger scale services, which are often more profitable in terms of their Medicare and Medi-Cal and private plan recompensation, tend to be happening at other hospitals, in the Bay Area. And the third factor problem that we are facing, you'll excuse me, the third problem we're facing, besides the inflation and besides the, diversion of patients to other regional hospitals, lies in the fact that we are just facing some very significant infrastructural challenges with regards to our capital equipment, to keeping equipment at the hospital. And fourthly, the fourth problem is that we need to have more payers. We need to expand our payer base, and we need to expand our line of services. Expanding the line of services requires capital that we presently do not have. And the problem that we have with expanding our payer base is that as a small independent hospital, we have relatively little leverage in negotiating power, bargaining power with the major healthcare plan providers. That is a similar problem to the problems that we face with our labor partners, and it is a similar problem to the problem that we face with many of our vendors.
The county is trying to form a joint powers authority to govern the hospital. Do you think this is a viable solution to its financial woes?
The core question about the county's plan, and also the other plans that are being suggested, at the end is the public has to ask, who is willing to foot the bill, and what premium are you willing to pay for keeping the hospital within local control? There's a saying in the business community often that you can have things either be good, fast, or cheap, but you cannot always have all three. And so therein is the question. There is the potential of a partnership with a for-profit hospital chain, such as Advanced American, or hopefully there's going to be some other letters of intent that I can speak about soon. That is the hope. And that would be a fast way. Of course, there is a risk in a partnership with a for-profit hospital that after a certain time, we can include covenants as to how they are to operate, but those covenants will ultimately expire, and at that point, there may be a risk to operating expenses. Now, another plan is the plan being put forward, which is the county and having Salinas Valley as a memorial. The question there is ultimately, as I said, who is willing to foot the bill, and how much of a bill is the public willing to undertake in order to ensure the solvency of Hazel Hawkins Hospital. And there, of course, the JPA does offer certain opportunities. It offers bonding opportunities. It offers development impact fees. But the question that the public of San Benito needs to be debating right now is, what is the premium that the public is willing to pay for keeping Hazel Hawkins as an independent hospital? So that is my
Thank you,
view towards
Director
the county's
Peck.
plan.
All right, thank you. I'm sure you'll have the opportunity to respond to more questions when we get to our audience. In the meantime, we'll go on to the Council of Governments. I looked at the mission ahead of time just so I could give it to myself as well as our audience. San Benito County Council of Governments' mission is to improve the mobility of San Benito travelers by planning for and investing in a multimodal transportation system that is safe, economically viable, and environmentally friendly. Just thought I'd toss that in. So, first question for you is, COG conducted a study recently regarding preferences for transit from Hollister to Gilroy. The study reported that those interviewed prefer a passenger rail option over bus transportation. Is more public transit in the works, and if so, what systems are most likely to be implemented?
Well, start with the tough question first. Okay, so there was a study that was conducted recently, and I do not have the numbers with me right now, so I'm just gonna talk in abstract. When you were thinking about transit, your options are, let's start with a small thing, carpool or vanpool, a bus, or rail. In the magnitude of cost it takes, let's just give an example. Let's say that carpool or vanpool, it costs a person $100. A bus, to run a bus, it might be costing you, if it is the same relative ratio, and don't quote me on the numbers, please, because I don't have the numbers. Let's just say it's going to cost you $20,000 to $30,000 to run it. That's not true. It costs millions to run it, but let's just call it that. To buy the bus, to operate the bus, to have the drivers, to have the maintenance on the bus, to all the things, it's going to cost millions of dollars. But the same thing, when you are looking at the impact on a rail, that's going to be multiplied by hundreds of millions. So something that will cost to run a bus, if it is like $1 million, it's going to cost you $300 million to run a rail. Because you have to now have capital costs, you have to have the rail, you have to have the maintenance that come. It's super expensive. I don't think we are at a point where we have enough ridership to sustain any kind of rail operations right now. It might be something in the works for future. We can do a rail if we have money, but I don't think we have $300 million to spend on a rail that may not have the kind of ridership that we are thinking about. So an intermediate solution would be to look at some other kind of transit, kind of like a bus or a bus rapid transit, something that will be a between driving and rail.
Okay. Second question for you. As the community grows, more residents will be walking and bicycling in the county. What is COG doing to provide and promote safe streets for all modes of transportation?
So the COG does not take a position on whether people should walk or bike or drive or take transit. What COG tried to influence the local agencies, and that is the County of San Benito, City of Hollister, and City of San Juan Bautista, is to provide mobility options. So should a person want to walk or bike, we want to make sure that there is a facility, that it's safe, it's accessible. Should a person want to take the bus, We want to make sure that same thing is available. So one of the things we have in our Measure G, the COG administers the Measure G, is about 5% of our total Measure G money is going into improving bike and ped facilities. On top of that, one of the things COG does, in addition to planning, is finding funding. So the planning is we try to identify what are some of the needs in the society, or what are some of the things that people think they need to have in the society. We are not saying that every local agency, whether it's a city or a county, should have the exact same number of bike or pedestrian walkway. We are saying if you think you want to have bikeway or pedestrian more than something else, we will help you find funding and planning for that. So in that respect, we try to, there is ATP, there is multiple state funding, federal funding, all that for pedestrian and bike paths, and we try to help local agencies find funding for that.
Very good. Okay, thank you. So what we'll do now is, again, go to the audience for questions. Just remind you to, if you don't mind stating your name, also to whom the question is directed, state it in the form of a question. Thanks.
Yes, thank you. Valerie Eglund, Reach San Benito Parks Foundation, and we have a big stake in the bicycle pedestrian accommodation in the county. And recently, we have been talking with Monterey, Santa Cruz, and Santa Clara counties about the routes that they have projected that should be connecting through San Benito County if we can accomplish getting there. My understanding is that the state mandates a bicycle accommodation on any new road as well as any renewed road. If you're doing repairs on a road, that there is at least 3 feet so that a bicycle can pass safely. And so I'm wondering how you project the progress of that through San Benito County, because it's going to count heavily in the bicycle tourism and the health and wellness of the community.
I would say that we are, the COG, when I say we, the COG, is very careful not to overstep our boundary onto any local agencies. So local agencies, they own every roadway infrastructure in this county, except for Highway 25, Highway 156, which is owned by Caltrans. So the focus of COG is to make sure that there is a good connectivity between the local agencies. The other focus is to help in planning. So we all know that the road doesn't end at the boundary of one jurisdiction, it extends. It goes from county to city of Hollister to San Juan Bautista to Monterey to other places, right? So the job of the COG is to make sure that transition between the county boundaries and between local agencies is seamless and safe. So to that degree, we are not telling the local agencies you need to have a bikeway or a pedestrian walkway, or it needs to be this way. We don't step on their toes. What we do say is that it seems that there is a bike path there, and there is a mile or a half a mile gap, and then there is a bikeway over here. Why don't we talk about what can we do to connect it so that somebody who chooses to bike can go without having to get into the mixed traffic and risk their life? That's the kind of thing that we encourage. And we find funding. So that's the two part, the planning and the funding.
My question is about Highway 25, because everyone's talking about growth, and I keep seeing more and more housing, and everything is growing and growing, and the horrendous traffic on 25 just keeps getting worse and worse and worse. Now we're talking about adding the landfill, adding all kinds of trucks to this same route. So what is the realistic, I mean, you're saying a train is not realistic, so it would have to be pretty much a bus. But if a bus is going down in tons of traffic, it's going to be every bit as slow. So what is the realistic time frame for expanding Highway 25 and improving the interchange with Highway 25 and 101? Thank you.
I completely agree. In the last 10 months, I know I'm the newest kid in the block. In the last 10 months, I have seen how bad the traffic on 25 is and how bad the traffic on 156 is. And even compared to other regions that I have come from, this is really horrible, especially because you don't have another route, a parallel route to go if there is a congestion and the road is blocked. So having said that, when Highway 25 will be built is a question for my board. I'm not the decision maker. I do give recommendation, and I bring data and facts and what needs to be done. What we need to do right now is look at what are the needs of the citizen. What do they want? Do they want 4-lane, full freeway style road? Do they want multiple choices of mobility? Do they want bus only lane? Do they want bus and carpool to be separate? Do they want express lane where you pay if you pay and get on the faster lane? What is it that you want? So we need to have a discussion about what is it that we are trying to address here. Does everybody just want to get on the car and go? We can do that. So depending on what is the thing that you want to do on Highway 25, that's what we will be working towards. Knowing that there are some policies that the state has put on us, not just San Benito, but all over the California. So the state has 2 rules now that changes the way we look at how we are doing study. One is the Senate Bill 743. Previously, it used to be called level of service, where you would look at how many cars or how many vehicles are going to be on this roadway and what's the delay for them. The state said that is not a good way of looking at things if you want to also factor in your climate and giving mobility options to people. So they said, how long is everybody going to be on that road? Like, what's the total miles you're traveling? So instead of number of cars, they could be just half the number of cars, but they could be traveling double the distance. That's going to count against us. And the point is, the state wants to provide a healthier, environmentally better, and a safer road for everybody. The flip side of it is, especially for community like us, where most of our people are going out of the county for their office and your work and school and everything, it's gonna be a different dynamics. So there's something that we need to look at and see that what can we do so that we can get what we want, but also align with the state goals that will enable us to get funding. Because everybody in California and everybody in US, every cog is asking for money from either the state or from federal. If we don't have a compelling story of why we should get that money, we are not gonna get the money. So that's the thing that we are all, the board, and we are all trying to figure out. How can you make a compelling story about what we want to happen here in San Benito and sell that to the people who hold the money? So to that effect, last month in September, we had the California Transportation Commission. They came here to do a town hall. They visited us, they heard our presentations. We took them on tour on 156 and 25. We showed them the 25 101 overpass, and we gave them the whole story. And I think they were pretty impressed, because the next meeting I went to was in Madeira, and they were still talking about it. So that's step 1, because we are now telling them this is our issue, help us. Creating that awareness is a step 1. And then telling them that why we need it, and telling them we are trying to align with the state goals. We are building houses. We are doing exactly what the state is asking us to do, giving them the exact number of housing dwelling units that the state is asking us. But our infrastructure is old. And when we had that infrastructure, there were probably half the number of people that we have today. So when the number of people doubles, the infrastructure should double. But what we are doing or what we are experiencing now is a growing pain, as Supervisor Sotelo mentioned. It's changing, but change is very slow, especially when you are dealing with millions of dollars.
Director Pack, do you think that the criteria the hospital board set forth for potential partners may not have been broad enough to accommodate alternative solutions, i.e. a joint powers authority agreement?
Well, okay, specifically, a joint powers agreement, a lot of that really depends on what's in the charter and the initial bylaws of the JPA, and also with what governments and what agencies are a part of that JPA. That sort of determines the reach of the authority, and that determines how the JPA is going to operate, and it determines what powers the JPA will have as far as raising funds or revenue or regulatory functions or whatever purpose it has. So there's still a lot of details that need to be ironed out by all of the parties that might be involved in a JPA, and that requires a lot of feedback from a lot of stakeholders, not just the county and Hazel Hawkins Hospital, but also our neighboring communities, and also some input from whatever group may be theoretically coming in to do a managing agreement with Hazel Hawkins Hospital. So there's a lot of the devil's in the details, and the details with regards to a JPA is how is it going to be funded, who is going to be expecting to contribute what level of funds, and how is it going to be constituted as a board, and how is it going to operate as an authority. So,
Thank you. Maureen Nelson. This is for Binu. You had gone over a couple different alternatives in dealing with traffic and commuting out of our county. What I didn't hear in there is more of a hybrid in using busing at set times to then commute to the rail station in Gilroy. When we first moved here, my husband went to San Francisco downtown for 2 straight weeks. He drove the first day and said, "Oh, not again." And then he was told by one of the employees where he went at Square, "You take the train." So I also took a bus when we had the major earthquake. We lived in Santa Cruz at that time, and I was going to San Jose State University. So buses are very efficient and economical, and may be an alternative as a hybrid option. I am hoping that that's being looked at and just wasn't included when you gave your list, which was very appreciative.
Absolutely. It is one of the top things that we will be looking at. And I'm going to expand a little bit more on that. So, as I mentioned at the beginning, COG doesn't own any infrastructure. We don't own any of the roads. So a big part of what we do is partnership. We create partnerships. We create partnership before we have a need for the partners. Because when you go and ask somebody for money, they're going to say, "Well, sure," and then they go their way. They don't give you the money. But if we have a partnership and we stay true and we are trustworthy, they will come together so that we can apply for money together. So to that effect, we are having conversation with Santa Clara VTA. They are our counterpart in Santa Clara. And the reason being, one of the things we are looking at is if we are putting a bus to go take you to San Jose or Gilroy to the Caltrain station or to the BART station, you're going to sit along with every other car on the road, either both on 25 and on 101. But if VTA and we can talk about if we can create some kind of incentive for the bus, whether it is a signal priority, where the bus, when it comes to the signal, the bus gets a green light. If they can do that, or they can have some kind of bypass on the ramps where the bus doesn't have to be staying behind a long line on 25. You all know southbound 101 in the afternoon when you're coming from San Jose into town, most of the time you're sitting on that ramp. If there is a bypass for the bus to get out of that line and come to the front and get on to 25, that's an incentive. We will also work with all the employment of officers in San Jose or Gilroy to see how can we, for somebody who is taking the bus from here, when they get to the Caltrain station or the BART station, how are they going to do that last mile? How are they going to get to the office other than take Uber? So if there is a way you can work with the employers in either Gilroy or with San Jose to say that, hey, can you provide a shuttle for that last mile so that our people, when they take the bus, they're not waiting there or they're not walking 20 minutes to the office. These are small things, but this makes a huge difference. And that's the kind of partnership we are working with. And I mentioned California Transportation Commission. They give out $3 billion every year in funding for projects. And the more partnership and the more stronger our partnership is, the better our chances of getting money. Because we are a small county, we are not strong on our own, but with Caltrans, VTA, AMBAC, which is our Metropolitan Planning Organization, we have a stronger voice. And that's the kind of partnership we are doing. Yes, absolutely the bus is on our list of things to do, but not just creating the bus, because if you take the bus the same amount of time as a car, you're not giving them any incentive. We have to make the bus at least a little bit better. As Mayor Casey tells me, she keeps telling this, you need to at least provide Wi-Fi for the people who are taking the bus. They need to have some way of either working, sleeping, or calling people without all the noisy bus that we have. So if we can make it a little better for people, I'm sure that would be it will go a long way. Sorry for the long answer, but I love the subject.
Any more questions over here? Hele?
How is the local government engaging with the community to ensure that diverse voices and perspectives are included in decision-making processes?
Is that for Binu or for
Both of you.
Okay. Well, in regards to this San Benito Healthcare District, I mean, we can't refuse any patient. We have to accept everybody that comes in through our doors. And you know, we do have a very diverse staff, and you know that is an ongoing. You know, I mean, first of all, level of care, professionalism. That is the highest priority of our HR department. But you know, we are looking at being a fair employer, certainly.
San Benito County is a population of about 67,000 people. 63% of that is Hispanic or Latino. So major part of it we are addressing with the diverse community and raising the awareness through our equity. So we have, one of the stories that we tell the state is that we have different type of people that we need to serve. So it's not one fit size all. We cannot put like one roadway and say that everybody go there. We have different needs for people. We have people who are going to office. We have people who are going, students who are going out of our county for education. We have people in the service industry. We have high-tech workers. So it's a mix of everybody. And the road should meet the need of every single person, because the bottom line is you're not providing a road to people to go, but you're trying to improve their personal quality of life. And that's the underlying for any project we take.
Question back here.
This is a question for Mr. Pack. You suggested that the community's question is whether we're prepared to pay a premium for local control. Can you describe the benefits of local control, and how will the premium be paid, in higher taxes or lower services? So we can answer your question.
Well, that's for the governments participating in the JPA to determine. You know, when I was speaking about the devils in the details, the JPA, there are different options. It can have a bond raising authority, it can have impact fee authority, or of course, there's the potential of going to the public for a local tax. So those are all pathways. And, when I say that I can't necessarily answer about the JPA, that's one of the things of, would the JPA be providing revenue through impact fees? Would the JPA be providing from bonds? Would it be providing funds from a tax? And given that, I don't know what the answers are, or, that's the part that has to be discussed in talking about a JPA is how is it going to be balanced out between those three different revenue pathways?
Thank you. Can you describe the benefits of the current system of a county-dependent health district?
Well, the benefits of the current system, of course, is that it's a small, local, independent hospital. The public elects 5 members to the board who govern and who basically serve as sort of the legislature and direct the administration of the hospital and how to conduct its practices and policies. So, that's, well, essentially one of the things is, local control and having accountable local leadership versus, a larger partner would be a better negotiator in terms of the economies of scale. The overall state of the healthcare industry, because of the Affordable Care Act, the healthcare industry is going in the direction of greater consolidation and greater monopolization, and that makes it small. It makes it difficult for small hospitals and small independent businesses to operate and get consideration from the large healthcare payers and consideration from Medicare administrators and from vendors. So the advantages, well, like I said, it's a question of having local control, having the leadership and the decision-making being made by people who are residents of this county and residents of this community. And, so that is the question I'm continuing to raise is, I have heard and expressed interest in that preference, but the question is, what premium is the public willing to pay for continuing that local control?
Okay, we have another question for Director Pack.
Devon, thank you for being here. You have always been very upright and very forthcoming in your statements as what you're planning to do with the hospital. You asked a question, what burden the community is willing to put up in order to save the hospital? It's not just the community. It's the community, the physicians, the board, the administration, the insurance scenario, the union of nurses. We all have to work together. The community has to offer to come and use the hospital if you guarantee that you will provide us with safe and efficient services, all right? You've lost a lot of faith. The community has lost its faith in the hospital, and that's why it doesn't use the hospital. In the past, the community used the hospital. We survived very well. We didn't do badly until the bankruptcy clause hit us. There were many reasons, according to the physicians and myself, that were responsible for that. The physicians were not referring the patients to the hospital because of their lack of trust in the administration. The board suffered the present administration without taking steps in spite of the fact that it was in their term that they declared bankruptcy. Sorry. So the major question is increasing the number of insurance companies that we have with our system. Secondly, satisfying the union members of the nursing union. So have you planned anything in the near future if you are to continue as you are in changing anything in the administration style or personnel in order to perform better?
There is going to be a performance review of the interim CEO. My understanding is that the HR department is currently surveying department heads, and we are going to be looking at a full professional review of the interim CEO's performance in her role. She has been serving since July. One thing that I would like to mention as related to this, of course, is that it was the assessment of the board earlier this year that a replacement or a new CEO, new administration, the costs of headhunting as well as offering a competitive salary was, given our current financial circumstances, we did not feel that it would be a prudent maneuver. That is to say, it's not just a matter of the present administration, it's also a matter of what is the replacement cost of finding a different party to act as the administration. And right now, with our cash reserves being as low as they are, being at around $12 million as of the last financial committee report, there is a hazard of, do we really want to be, allocating towards the expenses of a search for a new executive and the premium that we would probably have to offer in order to recruit and retain such an individual. So that's part of it. That's not to say, we're waiting to see what the feedback is from the department heads. We are going to be performing an annual review of the interim CEO's performance, and we will be making a decision based off of that, off of what we are told by our staff as to how the administration has been performing. So I am going to be deferring to the experts. And so what the heads of our departments, the heads of our nursing, what they're saying about what they think about the administration is what I'm going to be listening to. So.
Okay, I think we have time for one last question, which is right here. Yeah, you're on.
Sorry. Gosh. Okay, so my question's for Devon, and I wish I knew a lot more about the situation. But what I've seen in living here in Hollister is when you have an emergency situation with somebody in ER, suddenly a helicopter is being called and they're taken out of town. And what I want, and I don't know if I want JPA, the good, the fair, or the great, but I would like a hospital that if I was in an emergency situation, I felt like you could take care of me and not ship me out in a helicopter that costs $86,000. So for me, that's my hope, is that we could get to a place where we could actually take care of our people too and not helicopter us out. Thank you.
So the question is, I guess, can we get there?
Can we get there?
Well, this is one of the examples of how all of the problems synergize and interrelate. Our air transportation from Hazel Hawkins is because there are concerns about using Highway 25 during peak hours. And I expressed this worry to the CTC when the California Transportation Commission is that we do not have passing lanes for emergency vehicles. And that affects the number of doctors that are willing to refer services to Hazel Hawkins. And it also affects our planning and our characteristics when we're considering transferring a patient to another hospital. But the other factor is that we need capital to expand service lines. If we're to be keeping people here at Hazel Hawkins, we need to be expanding into things like a cardiology unit, an oncology unit, a nephrology unit. That takes money. That takes millions of dollars. And the fundamental problem is that we do not have the capital reserves to be able to grow out those services, to expand services in those directions. And so whether it is the government of San Benito County or whether it is a private party, the hospital needs a partner that is willing to contribute the funds and that believes that those funds will lead to a viable strategy that will expand the business of Hazel Hawkins, that will expand the payer base, and ultimately bring Hazel Hawkins to a satisfactorily profitable level of operations. Right now, Hazel Hawkins is barely marginally profitable, and I mean a very, very small margin. We do not have a lot of capital reserves, and that means that we don't have a lot of redundancy or contingency in our operations. You know, there's a lot of old equipment that needs to be replaced that we are continuing to use, and we can't invest the money in a lot of upgrades that would be helping to keep medical services at Hazel Hawkins. And so we need that money from one source or another, whether that is a private or a nonprofit or a government agency.
Sorry. Or state anything that you haven't been asked that you would like to share with the community. So we'll start with Binu, and then we'll wrap up with Devon. Thanks.
Well, I have a lot to say, but I don't know what to say in 2 minutes. So I would say that I'm going to borrow from Supervisor Sotelo. You're going to see a lot of changes in the near term, in the next 5 years. And to me, that is beyond something you can dream of as a COG director, because everything at a COG level happens in 20 years. So to say that you will see some immediate changes in 5 years, you have no idea what the fluttering in my heart. But this region is at the cusp of a lot of big changes. So we have a very good story. We have a compelling story to tell. I've been making a lot of connections with our neighboring counties, with people who are willing to partner with us to tell our story. And one thing I forgot to mention is that if you are interested or if you care about transit, then we have some good news coming our way. Next spring of next year, we'll be getting $8.2 million to improve our transit facility. It is dedicated for transit, so we cannot improve our roads with that, unfortunately. But that is one step in the right direction. We will get our transit all in first-class shape, so when we have our Highway 25 finally built, we will have very fast transit. But roundabout 156, these are all things that's happening right now, and I know it is pain point right now, but if you wait a little bit, they will all be done, and you will have a fantastic transportation system here.
Well, in regards to my remarks with regard to Hazel Hawkins, there are not necessarily easy or fast answers. It's a complicated problem. We need help from the state level, from the county level, and as I said, we need to have a public discourse about what the public considers to be acceptable partners for working with Hazel Hawkins to resolve our problems. Ultimately, there's sort of two categories of capital that we need. One is the capital to just sort of be accepting the risk or the potential for loss over the time before it takes for the capital that you need for expanding the business, whether that's a plan of expanding the business by implementing new technologies and procedures, by expanding business lines, by attracting new payers. Whatever your plan is, the question is, do you have the capital to be able to kind of cover the transition period where we are marginally profitable or not profitable until your plan, whatever it may be, is implemented and realized. And so, yeah, I mean, we are definitely looking for a partner, but also we need to keep working on stuff like the thing that was a lifeline was the $10 million loan that we received from the state of California. That is something that has helped to ensure that the lights are staying on and will stay on through June at the least. So hopefully we can have some level of state abatement or forgiveness of that loan, and hopefully we can see some level of relief on other obligations that we have to the state, such as our seismic reconstruction and our seismic obligations.